Started, I want to call this meeting of our PPE Subcommittee meeting to order, and we are excited to have our director from the Department of Social Services with us today. And I understand they've been out doing great things this week, so that's why he looks so tired. You don't look tired, I'm just kidding. But I think he's got lots of information he's going to share with us, and then maybe tell us some things he might need from us. So we're going to go ahead and let you get started. You see who's here, so I think you're already aware of who was on this committee, so I don't have to introduce them. So you can just go ahead and carry on.
Okay. Thank you, Madam Chair Shealy. Senator Alexander, Senator Johnson, pleasure to be with you today. Yes, I'm dressed in a suit today, but yesterday I was in, jeans and a T-shirt as we were unloading PPE. We had about 60 DSS staff unloading PPE and disinfectant and wipes at 4 National Guard armories. And that PPE was intended to go to child care centers across the state. So, yes, different view today. My name is Mike Leach. I'm the director of DSS. I also have with me Emily Parks, our chief of staff, Don Grant, our chief financial officer, Amber Gillum, our deputy director of economic services, Conley Ann Ragley, our legislative liaison, and Susan Robin, our DSS controller. Thank you for the opportunity to share with you the work our agency has done amidst the pandemic to keep our staff safe and to serve the citizens of South Carolina. In the wake of COVID-19 emergency, we at DSS continue to take steps to continue our critical mission of providing food and financial assistance and promote the safety of children, youth, and vulnerable adults in South Carolina. We continue to focus our operations on our essential and priority business functions. We've seen the continued resilience of staff to continually adjust to ensure our clients' needs are met. I want to thank our professionals for their continued dedication, passion, and enthusiasm for what they do. Our work is done with heartfelt commitment to bring the realities of compassion and courage to South Carolinians we serve. I've heard so many stories of commitment to this work and helping, whether that's helping out a colleague, a neighbor, a client during this difficult time. We continue to work through barriers the pandemic has created to help our professionals and the clients we serve. It's an honor and privilege to serve in partnership with our DSS professionals during this time. So if you turn to slide 3, I want to give a sort of an overview of everything we've done over the last couple months in each program area, and whether it be things that are going really well or the challenges we have faced in the last couple months. Throughout the pandemic, we've placed an emphasis on communication early and often with DSS staff at all levels, with agency partners, and with legislators and clients. We've ensured our staff have access to guidance to be able to continue to serve South Carolina citizens while keeping themselves and their families safe and healthy during this pandemic. Some of the steps we have taken to serve our DSS staff during this time include making sure we consistently exceeded over 83% of our staff working remotely. That's approximately 3,500 staff, with an average being 85 to 87%. We published COVID-specific information on our intranet for staff and established a COVID Q&A email for receiving and responding to staff questions across the agency. Sent at least weekly emails to agency staff to update on COVID response and provide critical information and self-care advice. Held weekly calls with approximately 100 DSS program leadership to provide guidance and ensure work was progressing. Additionally, we've deployed supplemental technology tools to our staff to enhance their ability to work remotely. Some of these tools include agency-wide deployment of Microsoft Teams, a software tool that allows staff across the agency to have virtual team meetings, case conferences, and to collaborate on documents and ensure work is moving forward while working remotely. Our executive management team uses the tool every evening since the beginning of the pandemic to conduct a situational update brief and ensure we are addressing all issues timely and moving the agency forward. Another tool is our Windows virtual desktop. For our staff and contractors without agency-issued laptops, the tool allows the staff to securely log into the software, and it makes as if you are logging onto your work computer and you have access to all the necessary applications to virtually do your work. This has allowed us to image and deploy the Chromebooks, devices temporarily provided to us by the Department of Admin to our economic services staff who would normally have not have been able to do their work outside of the office. Another tool that we've rolled out is Video Connect. It's a secure video conferencing app that allows our investigators in the field to remotely consult with child abuse pediatricians across the state on cases where there may be physical abuse and they need professional guidance on next steps. The app is HIPAA compliant, and we are currently piloting in York, Lexington, and Richland counties, but hope over the next year we go statewide with this after we assess its success. We want to thank the Department Administration as we've received access to LinkedIn learning training for our staff, which provide access to countless valuable trainings on enhancing their professional skills. As of May 20, we have 1,152 staff in DSS who are registered and actively using this training tool. Our IT team has been working around the clock since the start of the pandemic to develop new and innovative ways to ensure our staff across the agency are able to do their jobs and move the work of the agency forward while working remotely. And I would put my IT staff up against any other state agency IT staff in this state.
Director,
Yes,
can
ma'am.
you tell me what percentage of your staff has worked remotely and what percentage is still in the office?
I think right now we have about 83% working remotely. And I mean, you're
And they're still working remotely, and you have,
correct.
but you do have some working in the offices still?
Correct. We the folks who have been remaining in the offices this whole time are economic services staff that are working SNAP benefits. We also have our DSS Connect, which is serving folks who are calling into the hotline for SNAP. We also have our child abuse and adult hotlines. We have 4 hubs across the state, and those folks have been working in the offices the whole time as well. We did focus on economic services folks who are high risk, who felt uncomfortable working in an office situation. We did provide them with the Chromebooks with all of the necessary databases so that they could do the job from home.
I think Senator Johnson, Senator from Clarendon, has a question.
Yes, sir.
Madam Chair, I wanted to refer back to the folks you have working remotely from home. I think they said it's about 3,500 DSS employees.
Correct.
And so I know that there is I work for DOR when I'm not doing this, and we're working at home also. So I know that there is slowly transitioning people back into the office, but how do you see that working with, we still have the pandemic, we still have to worry about social distancing and those types of things, and making sure that we have proper PPE, whether it be mask, gloves, hand sanitizer. So for DSS, how do you transition people back from home to the office? And because of this situation, do you foresee any situations where you would just allow people, maybe it's more feasible or for whatever reason, to continue to work at home? Just kind of curious about that.
Yeah, great question, Senator. So Department of Administration provided really good guidance on a 3-phased reentry plan. First phase, being June 1, is acquiring all the necessary PPE, cleaning supplies, sneeze guards, things like that. We put in our request at the deadline, and I believe Friday we will be getting our first shipment of those necessary supplies. Making sure that we put the appropriate signage that's developed by DHEC and the Department of Admin into our buildings. We're also, as leadership, we're going to do virtual site visits with every one of our sites to make sure that there is proper signage, proper walkway flow, making sure that our entryways and seating areas are social distance. That is all the things that we are going to be doing over the next month. We are going to take a slow approach with bringing staff back in. I want to say that the governor on a Friday, said non-essential staff, need to go home and work remotely. We looked at it as critical in-office and critical non-in-office staff. Everybody's critical to our mission. By Monday, I had over 80% of folks working remotely. We worked pretty much that 48 hours after that Friday to make sure that we had everything in place for that. I am going to take a different approach with coming back. I provide an email every week to my folks. I get about 100 back after that email. 99 of those are positive. And then you have the one, who doesn't feel like maybe we've communicated enough or we need to be doing more. But in those positive emails, it's also, I'm still worried. I'm still anxious. I'm still scared. We have seen good productivity. We've seen many of our goals continue to be achieved. And I'm going to make sure that the safety is on the forefront of my thinking when I bring my folks back into the office. The other thing I have to think about is, we have had 13 exposures with staff across the state. I have had to close down 3 offices at any given time, get those cleaned. We have a process in place for cleaning and deep cleaning and janitorial services that we've had to spend money on. And if I start bringing back people too quickly, that could shut down more offices and our operations. And I cannot allow us to get behind on SNAP applications and the work we're doing. We saw a 150% increase. When I get to that slide, you'll see that. So we're getting more work through this. And if I were to lose staff in this process by not putting in all the necessary steps and taking my time, it could be very detrimental to our citizens. On page 4, on slide 4, I'm going to focus on economic services as one of our program areas right here. We at DSS know we have a critical mission to serve some of South Carolina's most vulnerable citizens, and that mission does not stop in the middle of a pandemic. In fact, it could be said that our mission is more critical than ever, with many South Carolinians experiencing unemployment, increased need, and increased stress and anxiety during this time. DSS received approval on a waiver from Food and Nutrition Services to allow us to provide an emergency supplement to address temporary food needs to households already receiving SNAP benefits and those new applicants who meet eligibility requirements for SNAP. The waiver brought all current SNAP households up to the maximum benefit amount for March through April. Over 175,000 households on SNAP received additional benefits thanks to this waiver. We temporarily suspended our able-bodied adult without dependent and TANF work requirements to minimize disruptions and benefits in the light of COVID. We've adjusted certification periods for existing SNAP recipients to minimize interruptions and benefits for low-income households and reduce workload for staff. The period of extension depends on client classification, but there will be no interruptions of benefits for any individual from March through May at a minimum. We utilize SNAP education and training program funds to provide tablets to SNAP employment and training clients to help them continue moving forward with certification trainings while they're are isolating at home. We've been able to provide this to approximately 55 clients with the available funding. We've worked with SNAP employment and training providers to provide internet service for SNAP recipients so they can attend online training programs during this pandemic. This is not normally allowable support service, but DSS contacted and received authorization from FNS, Food and Nutrition Services, and got this approved. DSS received approval to adjust the SNAP application process to eliminate the need for an in-person or telephone eligibility interview of all necessary verifications that can be completed without contacting the applicant. The abbreviated application process began the second week of April and has allowed for quicker and more efficient processing of SNAP applications and approval for benefits. There was a 2-week period that we we were, with that 150% increase, we were having, 12,000, 15,000 applications in one day. And we were struggling to keep up with the demand. And this process has helped us. It took a couple weeks to really fully implement and get going, but it has helped out making sure that we can get benefits timely to folks. And then we've temporarily increased the incentive amount available to SNAP recipients participating in the Healthy Bucks program to $15. This will take place from May 15th to July 31st. The purpose of the adjustment is to further combat food insecurity among SNAP recipients and to promote economic stability for Healthy Bucks vendors whose businesses may be impacted by the pandemic. You turn to slide 5. We've provided over $102 million in SNAP benefits during the month of April, and it's approximately 600,000 clients. This is compared to 67 million benefits issued in February, approximately 560,000 clients. Since the week of March 7th, we've increased SNAP recipients by approximately 27,000 cases and over 51,000 clients. We've processed 44,000 SNAP and TANF applications in March, was a 150% increase. We provided SNAP replacement benefits for 15,000 SNAP households, totaling $4.2 million in federal benefits due to power outages from the April storms. Senator Alexander is aware because Oconee County was hit very hard, and that whole county qualified for the SNAP replacement funds for SNAP recipients. So in the middle of the pandemic, again, you had the 27 tornadoes in addition, which increased our workload again with having to focus on SNAP replacement and making sure that we met the needs of our citizens in many counties and many zip codes across the state. If you turn to slide 6, I'm going to take you to another area of the department, child care.
Madam Chair, before we go there, so, and thank you, for the great work of the agency in dealing with that, with the SNAP program, not just for the storms, but through this unfortunate situation with the virus. So, and maybe you hit on it earlier, but I just want to circle around back as far as where you are today going forward, as far as the application process. Are you at 50%, 75%? I mean, what kind of backlog are you experiencing, or is that kind of calmed out at this point?
So I believe Senator and Don may be able to assist if I get this wrong, but I believe that by the end of this month or the early next week, we will be, our projections show that we will be caught up.
Great.
Yeah.
Thank you. I know it's been a lot of work on behalf of your dedicated employees to be able to be caught up by that.
It was a very tense situation for a few weeks when we started seeing 12,000, 15,000, and we knew that as the unemployment numbers ticked up, we were going to start seeing an increase in numbers. We already, lack the necessary staff to get the job done on a daily basis as timely as we need, but Amber Gillum and her team adapted very quick with our IT division and made the necessary changes so that we could get caught up. Folks, we still have 30 days to complete the whole process. There have been folks who we've gone over the 30 days, I'll be honest, and then there are times where as of now that we've completely caught up. So I think we're in a good place moving forward. The SNAP application numbers are still above the normal daily amount. Let's say you get 700 to 800 a day on a normal basis. We've seen it get down to about, last week we saw a couple days where it hit 700 to 800, but yesterday hit 1,300. So we're still seeing higher than normal days with applications.
Thank you.
Focusing on child care, the Division of Early Care and Education within the Department of Social Services is the government agency in South Carolina responsible for licensing and oversight of specific child care programs. Approximately 4 weeks ago, South Carolina received about $63 million in additional federal child care funding through the Federal CARES Act. DSS is using these funds to implement 3 primary assistance strategies designed to help essential workers and child care providers. One of the actions DSS took immediately upon receiving these funds was to open the SC voucher program to provide child care assistance to workers deemed essential during the COVID-19 response without regard to the regular income eligibility requirements. The purpose of this temporary program is to help essential workers pay for child care while they report to work during this emergency. In other words, those engaged in providing essential services, those involved in making sure the public has access to critical services, and those involved in critical infrastructure operations are eligible. And due to the overwhelming response, the application period for the benefit closed on May 8th. Approximately 6,551 applications for this assistance were received. As of May 26th, we've approved 3,665. 368 have been denied, and 2,518 are pending. That's approximately $17 million obligated for the 3,665 approvals thus far. So obviously, we're going to be over the 20 million mark just in that aspect of that CARES money, that $63 million right there. The second response that we implemented with the additional CARES Act funding is cleaning grants. A one-time cleaning and sanitation grant has been made available to licensed or registered child care providers. The purpose of the grant is to allow providers to clean and sanitize their center, family, or group child care home, which may allow them to reopen or to continue purchase additional cleaning supplies. As of May 26, DSS has issued cleaning grants to 701 providers. DSS is still accepting application for these cleaning grants. Information about how to apply in the application form are posted on our scchildcare.org website and were sent to all the child care providers via email in mid-April. Approximately $1.28 million in CARES funding has been allocated for these cleaning grants. And lastly, on Wednesday, May 20th, DSS stood up a program to deploy larger grants to licensed and registered child care facilities to help providers who have had to close or who are open and have lost revenue due to low enrollments during the last several weeks. These one-time grants are designed to assist providers in paying for their child care facility expenses, including rent, mortgage payment, utilities bills, cleaning or sanitation costs, and personnel costs. So it's very wide open as far as how that can be used. Child care centers grants are based on license capacity and range from $10,000 for centers licensed to serve up to 49 kids to $15,000 for centers licensed to serve 100 or more kids. Family child care homes and group child care homes are eligible for $5,000. Providers who have closed and continue to charge private pay families are strongly encouraged to use a portion of these grant funds to offset the cost of parents. And as of Tuesday, May 26, DSS has received 1,180 applications in the amount of $12,194,000. Additionally, since March 15th, we've maintained ongoing and continuous communication with our providers. We want to make sure they keep up to date and latest recommendations regarding COVID, share information and resources, and answer questions. We work with DHEC to provide guidelines to assist child care providers in reentry for opening quickly and safely. The guidance was sent to providers on May 14th and can also be found on Accelerate SC and scchildcare.org websites. That is all I have for the child care section at this point in time. Any questions?
I got a question on that.
Senator Alexander.
So, of those child care facilities that have closed, are you tracking, are you seeing some of those or a lot of those are not going to reopen? And what is that going to, if that's the case, what is that going to do for child care, especially for working parents?
Yeah, great questions. So yes, we've been tracking on a daily basis at noon and 5 every day. If you go into our 631 conference room, you will see white sticky sheets all over with just random numbers of what you're talking about. Currently 54%, 1,108 are currently open. That means 46% are currently closed. I'm sorry, 1,300 are currently open, 1,100 are currently closed. So 54% are currently open across the state. We have 2,419 childcare centers. We have been reaching out and trying to make contact with childcare centers to understand where they are in the process of potentially opening, when do they think they're going to open, reasons for that they did close, and working with them to see what their needs are around that. I do see that there will be some who maybe do not reopen. And what I can say coming into South Carolina and understanding sort of where we are as a state, there are childcare deserts in the state. And we are going to need to focus some of the other additional childcare block grant money that we have in improving the quality, enhancing the quality of the ones we do have, but also figuring out how we break down some of these childcare deserts and some of these rural areas, because this could be detrimental. Every state is having this exact same issue. USA Today had an article recently. The New York Times had an article today. I've looked at other, states gathering information. We received 63 million. Georgia received 144 million. And they would tell me today that's not enough, and I would tell you today that that's not enough to help support these child care centers. And I think advocates across the country would say that there needs to be another how many billions of dollars to support child care centers and not going under across this country. So I think we're going to try to do everything we can to support opening and to make sure that we keep them on track. But I do think that this is going to be, the longer it goes, Senator, the more detrimental it's going to be on folks. Even if they applied for, the payroll protection plan and some of these other federal things, I think it's going to be a challenge.
I do one follow-up on that. So these childcare facility homes or companies had the ability or have the ability to apply for the triple P loans and things of that, if they're a private entity.
If they're a small business, I believe they would qualify.
I have a question, Director. Of the 1,108 that haven't opened, I mean, I'm sure that you said you're in contact with them. Are some of the people that you're in contact with, what kind of, are they talking to you, telling you that they're not going to reopen, or what kind of excuse, what are they saying?
Yeah, I think some are going to say, some are saying we're going to open in June, some are saying we're open in August. Others we haven't been able to get, answer email or a phone call.
So you think some are just going to wait till after the summer and open and see what the climate is? And
I believe you will see some of that, right? Some of the reasons for closing, highlighted to us. We follow the school schedule. The idea that there was an executive order with child care centers, and there wasn't. Safety of children and their staff. But I do think there will be some, we're going to see some open up next week all the way through summer, and you probably see more open up during the school year, yes, when the school starts.
Thank you.
I'll follow up on a little bit more on the child care. On the next slide, you'll see a bunch of pictures, and that was, Senator, that was yesterday with folks across the state moving PPE around to make sure that we provided it to child care centers. So, we've been on calls with the governor 7 days a week for, a month and a half. At one point, as we were providing updates, we started talking about how do we make sure that we can support these folks in reopening, and what does that look like? South Carolina Emergency Management Department, Commerce, Forestry Commission, National Guard, Governor's Office, everybody was very responsive. Department of Transportation, everybody was responsive in saying, what can we do to assist? So we were able to get lots of this stuff, and we were starting as, hopefully by June 1, we'll get all this deployed out to child care centers who made requests for these needed things. But it was great partnership and making sure that we were able to do that. See, I think we answered. I think through this, we also were working with some partners to set up some temporary child care sites, and these organizations were allowed to operate for 30 days without a full license, but must be approved by our licensing division. We have about 15, approximately, that were currently in operation with a licensing capacity of 554 children. So we also tried to make sure that we set up some other ones across the state to be able to assist as much as possible. We have also continued to provide voucher funding to child care centers, even amidst closure, for enrolled children. So, if your child wasn't going there for whatever reason, we were still providing that voucher and that funding to that child care center. The single exception to this would be if a child has moved to a different child care center during the closure, in which the case the voucher and funding would follow that child. And then we partner with Merchant Food Services up in the Newberry area to set up 4 access points for providers across the state to obtain needed food resources for their child care centers. So we've had a few sites set up across the state. If you turn to page 8, that gets into our child care work, our child welfare work, I apologize. So even amidst the pandemic, we at DSS have continued to see improvements in our child welfare program metrics, including a decrease in bed days compared to last year, which means children are potentially going home to more timely permanency. An increased placement with kinship caregivers. I can say based on our last AFCARS data, that's federal reporting that we provide to the federal government every 6 months, that we are not dead last in utilization of kinship caregivers anymore. Better, but not good enough. So still a lot of work to be done. We've seen some more placement stability, meaning kids are not moving as much during this period of time, which is great because we know that more moves equals more trauma and more time in the child welfare system. And we've continued to see our 4E eligibility rate go up, which we have provided in other subcommittees that information as far as how we're continuing to make the most of potential federal funding. Even drawdown on clients that are coming into the child welfare system. The child abuse and neglect and vulnerable adult abuse intake call centers, the ones that I talked about earlier that are still working from the office. As of the week of 5/11 through 5/17, we saw a 51% decrease in child abuse and neglect reports received, and a 7% decrease in vulnerable adult abuse reports received. And that's about a 43% overall decrease when compared to 1 year ago at this time. We believe the reports of abuse and neglect of children are down because, our education professionals, teachers, guidance counselors, et cetera, are mandated reporters, and they don't have eyes on students like they normally do. Drops in reporting usually occur in our summer months, so states across the country usually see a trend line that goes down during the summer months. Our trend line has gone down significantly starting in March. Typically you see this for about 3 months. We're going to see this probably for about 5.5 months of lower reports to our hotline. We can correlate that to the drop calls in our intake reporting hubs across the state. We've had several conversations with Superintendent Spearman and the Department of Education working to encourage teachers to continue reporting suspected cases of abuse and neglect, since they are visually seeing children virtually through online instruction, and also working with bus drivers that are delivering school meals to also encourage them to report cases of abuse and neglect as they see it on the road. We've also had similar conversation with the Department of Mental Health, who are conducting virtual sessions. Many of their counselors are in the school system, so they have continued to do that work virtually. We've also begun an aggressive social media and earned media blitz throughout the state, talking about the issue and encouraging the public to report or call it in. Thanks to several media providers, DSS is running digital billboard PSAs at no cost to the state, encouraging the public to report suspected abuse of children and vulnerable adults. The Outdoor Advertising Association of South Carolina has asked their members to run digital billboards, and participating members include Adams Outdoor Advertising, Coastal Outdoor Advertising in Myrtle Beach, Covenant Media of South Carolina, Myrtle Beach Outdoor Advertising, Grace Outdoor, Renfro Outdoor, Lamar Outdoor Advertising. And we additionally, thanks to the collaboration with Director Toomey and the creative media staff at DHEC, we at DSS were able to create a 30-second PSA on the same subject of reporting abuse or neglect of children and vulnerable adults. This PSA is running on television stations statewide thanks to donated time by Comcast and Spectrum Charter Communications. This ad can also be found on DSS social media sites, including Facebook and Twitter. Our leadership acted quickly and early in the pandemic to provide guidance to staff and partners on how to protect themselves and the children and families we serve in the wake of COVID-19. We still have a job to do, so we still have investigators on the Adult Protective Services side and the Child Welfare side having to go out and do face-to-face visits. And you can't call ahead and let people know you're coming and make sure you're protected. So we quickly put protocols in place to make sure that people were asking 5 or 6 relevant questions and providing them with PPE when there is a concern to make sure that they are safe as they go out and do these continued visits. We continue to coordinate contact with our children and families so that fewer case managers are traveling from across the state to make visits with children and youth placed outside their region of origin. We've been providing guidance on alternative technology-based visitation practices such as FaceTime and Skype. We've reduced in-person contract monitoring visits in most areas of our work. We're maintaining current practice with investigations in OHAN to ensure safety of children in facilities and the allegations are investigated timely and properly. We're following CDC guidance to use screening questions to determine risk. We've provided foster parents with information for the free MUSC telehealth screenings and Select Health 24/7 nurse phone line available for children in foster care with Select Health and Medicaid. Providing guidance for foster parents to have age-appropriate conversations with children who may be experiencing increased anxiety. We moved all our foster parent training and new child welfare case management training virtually. Provided direct contact information line for foster parents and providers to address specific questions that may arise during COVID, but also pre-COVID. We in South Carolina work quickly on this because we know the anxiety and the fear of our staff that they were dealing with, and we provided the guidance prior to the federal government providing the guidance. Face-to-face contact and is essential in our work. Building relationships, engagement is a necessary function. It's also a federal requirement. We shifted to a virtual method before the federal government gave us full approval on that. We knew that was the direction that we needed to go, and the federal government finally followed suit with that. We've worked with our courts to conduct more virtual hearings to reduce the backlog of cases and increase permanency for children. Over the last 9 weeks of this pandemic, we have successfully finalized over 80 adoptions and have reunified approximately 150 families. Many thanks to Chief Justice Beatty, the South Carolina Family Court judges, guardian ad litems, and community providers who are taking bold steps to continue our mutual mission of promoting the safety and well-being of children and families. We have temporarily waived education, enrollment, and employment requirements, so youth and young adults in our aftercare system can temporarily remain in a licensed DSS placement until age 21 due to COVID, and those who have already turned 21 can temporarily remain in care through this pandemic. Our case managers are closely assessing their individual needs, including safety, placement, and housing, community connections, employability, academic goals, and financials. We were recognized in a national news source lately as one of the only 9 states to have enacted this protection for youth and young adults. And because of our federal increase in the Federal Medical Assistance Percentage Program, FMAP, the rate due to the current federal state of emergency, DSS has been able to provide an additional $90 per month as a temporary increase in board rates to foster families and group homes. So we served for 3,264 children in care during the month of March, so that affected that many, and 3,438 children in care during the month of April in the amount of $309,000.
Got a question on that, if I could, Madam? So, and thank you for doing that. I think that's great. When it says a temporary increase, so when will that temporary increase projected to end? On the $90 per month temporary increase in board rates to foster families and group homes for the 3,000, when does that envision that temporary time will be over with? Hit that green button there, if you would.
How about now?
Much better.
So the guidance we received from the federal government, we know that increase will be in effect at least through September. We're anticipating through December, along with some of the other pandemic guidance. It basically it will map along with the duration of the federal emergency related to COVID. So we're anticipating at least being able to make that supplement, which will be fully funded by that FMAP bump through the September quarter end. But on the horizon, what we're feeling with all the other guidance is we're hoping that will go through the end of the calendar year at a minimum.
That's 100% from the FMAP.
Yes, sir.
Thank you.
Any other questions on child welfare before I have you turn to slide 9 and look at adult advocacy?
I'd just like to say, for once, it's good to hear good news when you talk and not hear the bad things, and to be number 9 that's doing something right instead of the number 9 that's doing something bad. So we appreciate that.
Yeah, and my previous state senator chose not to do that, so I'm glad that we did. So
Well, and we appreciate that. So too many times we've been on the other side of that. So
we still have a lot of work to do in the child welfare system. You guys have heard me talk a lot about that. We still are implementing the right policies and practices. Our caseloads are still above average. You guys have seen budget presentations and are aware of the ongoing need as we presented in the House budget and some of the other things we've talked about 4E eligibility and some of those other committees. So, even I'm not. We are under-resourced and underfunded for sure in many aspects of this work, but that's not going to be an excuse not to continue to improve the quality of practice that we have. And so that's what we continue to do even through this pandemic. So even as we left, we had 70 folks on a virtual call on our federal program improvement plan. So they were going through every aspect of the child welfare system and figured out where we are. Are we seeing improvements? Are we going backwards? So the work's not stopping regardless of this. We have to continue to move forward. In our adult protective services or adult advocacy, we continue to investigate abuse and neglect cases while following the appropriate protocols to keep our frontline professionals safe. We're making virtual check-in calls with the adults who are in the APS system and not in danger. The number of intakes received by DSS for APS are down due to law enforcement taking less adults into custody, and our mandated reporters are sheltering in place. So that was that 7% decrease I mentioned earlier. We are following the directives of hospitals and nursing homes in limiting visits when vulnerable adults and utilizing technological alternatives mentioned earlier when possible and documenting efforts where we are unable to make face-to-face contact. We are providing guidance to staff on meeting the physical needs of our adults in alternative placement arrangements, as well as securing medications for these individuals. We're collecting critical incident reports on all APS clients who test positive for COVID-19 and taking all necessary precautions with those clients. We're also responsible for administering and monitoring state and federal funds to support local domestic violence programs. These local programs provide direct services to survivors and their children through emergency shelter, crisis counseling, advocacy, and more. DSS has a grant with 13 separate programs that serves the state through 17 emergency shelters. Each of these programs are monitored through a site visit or a desk review on an annual basis. We've been holding weekly calls with the domestic violence programs it supports in order to provide a platform for programs to give status updates, ask and answer questions, and to provide technical assistance for each other and how to navigate through these challenging times. We did secure and distribute PPE, not a lot, but some, to local programs and SCVASA with help from SCVASA in distributing these items. They could always use more. I think that is a need, making sure that our domestic violence programs have that necessary PPE so that they can continue their essential and most crucial mission, especially during COVID. I have heard some sobering statistics thus far with domestic violence, and so we need to make sure that they're in business and doing everything they can. So everything we can do to support them, it would be a big help.
Excuse me, can I do a question there?
Yes, Senator.
Yes, sir.
So other than the personal protection equipment and stuff, are there other ways financially that you've supported those domestic?
That'll be the next bullet.
I'm sorry.
No problem. We received $534,000 in additional Family Violence Prevention and Services Act funding through the CARES Act. This funding that's received will be utilized to assist in assessing the needs of domestic violence survivors in providing supportive services, shelter options, and supplies that would reduce the exposure and risk of COVID-19, and in promoting the continuity of services for survivors of domestic violence. DSS will be working with SCVASA and local domestic violence shelters to deploy this funding. We anticipate this funding to be distributed to the local programs within 60 days. So we did receive $534,000. We have not deployed that money at this point in time. And those calls hopefully will focus on what their needs are so that we can do something similar to the child care, where we deploy sort of large grant amounts to those settings.
Thank you.
If you turn to page 10, we can move towards our child support services. And DSS has a lot of responsibilities, and I'm going to focus obviously on the bigger pieces, but there's a lot of smaller programs that are in DSS as well, but I'm going to focus on the big ones. In child support, we are working to provide the financial support to deserving children while also considering the impact of COVID-19 emergency on non-custodial parents whose employment has been affected. DSS collected over $15.6 million in total child support collections on May 5th. Included in those collections were 11,519 items in federal intercepts. This was our largest single-day collection ever. Our child support team dispersed over $10 million of that collection amount in the same day. During that time, we received multiple communications from other states already stating that their system and staff could not handle their large collection file from that day, and those issues would cause a delay in making the disbursement of child support funds to the custodial parents. Many of those states have hundreds of more staff than us, and yet our team and our PAC system did not have any issue getting this money paid out to South Carolina families. The second largest collection day ever was May 12th. We collected and dispersed over $13.9 million in child support payments to South Carolina families. Again, the increase in at that time frame with a remote workforce, has been tremendous. In the light of the crisis, while the federal government requires certain enforcement measures to remain, the Child Support Division has relaxed most of its administrative enforcement remedies, including license suspensions, liens against financial assets, and credit bureau reporting. Automated processes are still in place, however, to garnish wages of individuals who are still able to work. The child support team is currently processing mail within a 2-day time frame on our AIM-Bell queues, and that's the lowest they've ever been as far as getting that stuff moving quickly. So we've been able to really adjust some of our practices, use technology, scan things in the system, be able to track those things better. So, we've seen some process improvements in many areas of the department because of COVID. Child support has done a tremendous job in making sure that they streamline many of the aspects of the work they do. With all non-emergency court proceedings being postponed, Child Support Services Division staff are actively making phone calls to affected individuals to advise them accordingly. DSS has had 12,736 child support cases affected by court closures. 2 counties, Abbeville and Dorchester, have already begun canceling June hearings. When court is closed and these child support cases are delayed, it can have a significant impact on our families around setting paternity, support, and judicial enforcement of the order. The current backlog of cases includes custodial parents waiting on support orders to be established or judicial enforcement. So we're doing as much as we can at this point in time and keeping track of what cases are going to be affected and how long, depending on how long this goes and the court closures. Any questions on child support? I do want to highlight one thing, that the CARES Act stimulus payments that were made eligible to non-custodial parents who owe past due child support and who are subject to intercept. Basically, the federal government made that decision to intercept federal, post-due, past-due child support and things like that. And so when you see those numbers that I was reporting earlier, a lot of those were stimulus checks or taxes. So that's why you saw those 2 high amounts. We're asking for guidance from the federal government for a while on, as this was playing out, as what is the direction they were going to go, so we can figure out the direction we needed to go. And they made that decision, and we and other states had to go along with that. Moving to slide 11, I want to talk about the federal funding that we've received through the CARES Act. So as the designated grant recipient for some of these programs so far, DSS has received CARES Act federal funding in 3 categories. $63,641,000 in CARES Act funding for child care response. We talked about what we were doing with that money. $534,000 in CARES Act supplement for the Family Violence Prevention and Services Act. So again, we still have that money and are working to deploy that. And then $797,000 as a supplement to Title 4B funding. And that funding will be utilized to protect and promote the welfare of children, prevent abuse and neglect, support at-risk families, and other allowable purposes, specifically those purposes and costs incurred in responding to the COVID-19 crisis. So that is a federal funding source, 4B, for the child welfare system. That's a program that we were already running a deficit in. So this money will be utilized to help cover expenses that we've been running short on for a while. Additional benefits amounts through FNS for SNAP and child nutrition and child and adult care food program are also being made available in response to COVID-19. Those are the things that you see as sort of that I talked about earlier, as far as that supplement to increase the amount of benefits for folks. If you turn to slide 12, This is what we, as requested by the Department of Administration last week, we surveyed all our offices and program leadership across the state to gather an estimated need of personal protection equipment in order to obtain, able to return to normal operations and return staff to the office. The Department of Admin's Phase 1 approach, beginning June 1, is the agencies should begin to transition staff back to the office who cannot feasibly work at home. DSS worked early on to quickly and efficiently transition staff, a large majority of staff, to work from home, and our agency has been operating in Phase 1 state of business since mid-March with a consistent 85% of staff working remotely. Our focus for Phase 1 has been to deploy, develop and deploy messaging and personal protection equipment to state, regional, and county offices so that when we are ready to transition the staff back into the offices, we'll have a safe atmosphere in which for them to work. Last Friday, 5/22, leadership deployed a checklist with instructions to prepare for facility readiness, a collection of signs to post throughout the buildings with self-checking guidance, social distancing guidance, and other instructions for creating a safe workplace, in addition to guidance provided by the Department of Administration. After receiving and deploying requested PPE from the Department of Admin, DSS executive leadership will be planning virtual walkthroughs with each DSS facility to ensure full completion of the deployed checklist for facility safety and readiness, and to ensure that each DSS office is fully prepared for the return of staff with necessary precautions. As we phase staff back into the office, we will be considering staggering remote work schedules for staff whose work can be efficiently done remotely, to ensure we're able to maintain safe social distancing in offices and between workstations.
Senator from Oconee.
Thank you, Madam Chair. In making your offices ready to go back across the state, are you also coordinating with those counties? I mean, they're normally, it's my understanding, those facilities are county facilities, and I'm wondering about the PPE. If there's been a coordination there that maybe some of the counties are going to be providing that to your employees, and they're providing the shields and things for y'all to be safe from that standpoint?
So Senator, we will be providing that to our county offices.
I understand, but have you communicated with those counties? There may be some counties that would be willing to provide that for you from that. Have y'all had dialogue?
Not
with
specific to PPE. The dialogue
or the shields or things that's going to.
Yeah, not specific to that at this point, and we can. Our dialogue with the county offices regarding the COVID situation has been a lot around sanitation, cleaning, who's funding what, specific to that. So as we are up with that, but our focus conversation has been that and not so much those other aspects.
And I'm not asking that you spend a lot of time on that, but I think there may be a way that some of that could be coordinated rather than being all on your shoulders, that they've got other employees that they're having to take care of, and to have y'all included in that. But again, I was just curious. It sounds like you're at least communicating with the counties and stuff. So.
Yeah, and Emily has been working with our EMD folks and Department of Admin, and it'll be interesting to see Friday and into next week what we've actually secured and where we get that out to. So we did an assessment of what is needed as far as sneeze guards and those kinds of things. So we know how many and where. We just need to make sure that we get those and then we deploy those quickly.
Director.
Yes, ma'am.
I have a question, and I think I'm going to go back to something that the senator from Clarendon asked earlier, like way earlier. We've found out that a lot of these people can work remotely. And will it come a time that you find that they can continue to work remotely even after this is over? When COVID has gone away for good, which, would be good to be sooner than later. Mm-hmm. But could there be a time in the future when these people can continue to work remotely, and that would free up office space or whatever we're doing, and people would like that would free up childcare, that would free up a lot of things. Right. But do you see that in DSS's future?
Yeah, and I apologize, Senator, for not asking that specific or answering that specific part of your question. Yes, I do think that we can become a more mobile workforce, and I think that Don and I have had conversations about potentially the cost savings in some of these leased buildings that we have that maybe we don't need if we move towards that aspect of it. The problem the department has for many years is outdated databases and making sure that you can utilize those. On laptops and Chromebooks, and there's the portals needed for these things. The last 2 months has really pushed us to have to again build those, put those things in place. I still think there's some technological deficiencies in some of our systems. Our SNAP system is 30 plus years old. We need a new system, and so right now. They've done a tremendous job putting those things on those Chromebooks for some of those high-risk SNAP folks to be able to do, but it is slow, and you can't do the business at the same level that you're doing the business in the office. So those are things we're going to have to keep assessing to move folks out of the office. Now, productivity, I think, is, I don't think that is suffered in many areas, and I think it's actually done well in some of the areas, but I do think technology is our barrier to doing this long term, making sure we have all the proper equipment and the proper systems to be able to do this. Our CAP system is still, we are deploying, thanks to you guys, we are deploying our, when I came on board, you guys had passed that budget with the additional $5 million. And that was able to increase the foster parent board rates, not to the USDA minimum that we've talked about, but to get them closer to that. Also, the technology, the 2-in-1 tablets, we've started deploying. It's taken us a little bit, and COVID. We were focused on early March, and things slowed down. But we have, I think, rolled out to 4 counties at this point, and we are going across the state to make sure that they have that technology. Once they have that, we'll be able to download a CAPS portal so that they'll be able to do their work with that technology without having to come into the office. So I would like to go. Listen, I'm new school in a lot of ways. I am old school with the whole office thing. But Emily and many others are, and this whole situation is changing my mind to go, we can do this. And do it well. We just have to have the technology for it.
Whenever you start working on a new SNAP program, don't get the same people that worked on the child support system to begin with, okay? That it took them 30 years to do. Let's just get a whole new set of people, okay?
Got it.
Okay.
Got it. Well, we will work on that when there's future funding for that. And slide 13 gets into our expenses incurred and anticipated. So we've worked diligently throughout the pandemic to record additional costs incurred as a result of the agency's response to COVID, as well as to anticipate additional costs that may result through 2020. As a result of the pandemic and its impact on the state's social service systems and the clients. So these costs include facility cleaning, janitorial. We've had to cover costs of that. As offices have had to open or close, as folks have had to, we've had to pay for some of those things when maybe it wasn't a co-located office with HHS. Payroll, supplemental compensation for essential on-site staff, child welfare investigators, and the costs associated with the direct and secondary impact to the agency's response to adult protective services, economic services, and child welfare services. PPE, remote working and learning, so Chromebook management licenses for staff to be able to work from home or other locations, go-to training licenses to continue to provide training remotely, laptops and peripherals needed to allow employees to work remotely from home, RSA tokens. Early on, that was the first hiccup was not having all of these things, and we had to decide early on if we were going to shift this direction, we were going to need additional broadband bandwidth, RSA tokens, laptops and Chromebooks and things like that to get the job done. And then our response efforts, housing assistance, rental, nutritional support, and transitional support to maintain employment for some of our youth and young adults. Costs of housing adult protective services clients due to facilities not accepting them due to COVID-19. So we've had to pay some additional state dollars to make sure that we find proper placements because whereas maybe we would have found a placement and Medicaid may have been able to be the payer. Additional financial resources such as financial assistance, food and health care, support groups and professional care, enhanced case management and legal assistance for foster children and families and kinship families. Foster care supplement assistance payments, technology. Again, I talked about RSA tokens. We've actual cost, over 1 million, but potentially through the end of December, we could see, potentially 16 to 17 million of costs, just based on when you think about the devastation it has on our communities and the need for social services moving forward. So as child abuse and neglect calls have been down, through March and April and potentially through the summer, we're going to see a spike and we're going to see a lot more kids. Our caseloads are going to go up. We're going to see more kids in foster care potentially. A system that we've worked to try to strengthen over the last year could be in extreme stress come fall. And that goes for adult protective services too. As potentially adults, we see more adults in hospitals or without a place to go, unemployment, food, things like that. So we're worried in fall what could happen to many children and families and adults that we serve.
And I share the concern, and I think bringing that forward is wise, and I appreciate that. But the potential and what we're charged with on reopening in South Carolina, and then with what's being provided by the feds, is my understanding, is that actually has to be for expenses incurred. And so we need to plan, but at the same time, I hope that it won't be to the extent that you
Correct.
are envisioning the number of cases that go up and stuff. So that's going to be a little bit of a challenge for us.
Yeah, expenses occurred by 12/30, and our numbers are gonna go up. I mean that is going to be the challenge, I think, for the General Assembly. Again, prior to this, I think the House had moved forward, or at least it had left the House with the potential 60+ million that we were going to need to strengthen all our program areas. We still need, based on all the work that we've done, just to make sure that we meet all our Michelle H. mandates and every other thing that we need to do well. That cost was looking at 126 million. Potentially, the cost to the agency as we move forward, again, with higher caseloads all over the place, and the need for more services for families. Yeah, you're right. It hasn't been incurred at this point in time, but we believe it will. So in summary, COVID has disrupted business as usual, and in many ways it has amplified our weaknesses of an agency and how under-resourced we are. There's no playbook for how to do this work in the middle of a pandemic, but I have tried to lead the agency by communicating early and often, being transparent, and keeping the needs, both physical and emotional, of our staff, clients, and South Carolina citizens in mind with every decision that needs to be made. Our DSS team members at every level of the agency have worked tirelessly to continue to provide services under these circumstances, and every area of our agency has adapted its practices and processes to this state of emergency. And even in the middle of a pandemic, we have continued to move this work forward. And with your help, we can continue our goal of striving for excellence in our service of 1 in 6 South Carolinians moving forward. Thank you. Madam Chair, Senator.
We appreciate the presentation, and I appreciate everything y'all done to date. I know there's a lot more work to do. I appreciate these numbers. That gives us something to work with, somewhere to go from here. And I know y'all are going to do a lot more work because there's a lot more out there to do. I'm worried about the kids. You know me, I'm worried about all those kids all these cases that aren't getting reported. So, you know, hopefully we can get eyes back on them sooner than later. I look forward to school starting back. I know there's a lot of people that probably don't look forward to school starting back.
I look forward to school starting back
Because
as well.
I think that's a big issue we have here, that, you know, school isn't going on right now. But, you know, I'm here to work with y'all. Y'all know that. I'll bug you to death. I appreciate what y'all are doing about the graduation. I don't know, you know, that the kids that are graduating, I think we have 98?
Yeah, I failed to mention that, but, you know, in the last year, we've been able to build our Chafee Independent Living Program up, and we didn't have one. We had one at some point, but a couple years had gone by where we didn't have one at the state. So we were, in the last year, we've been able to do a tremendous job in getting that built up and starting to provide better support for these youth and young adults that, you know, we've not done enough for. And so we you know, it's amazing accomplishment for anybody to graduate high school or college or whatever it is, but I don't think people are aware of the barriers it takes for anybody in the foster care system to complete that task. The numbers are dismal across the country, and so for any young person to make it this far is a true statement to their resilience and who they are. So, you know, I give
From
them
the records,
kudos.
I think a lot of them are going on to college, so I'm, you know, excited about that. And
Yeah, and that's, you know, thank you for, you know, supporting those young people and
you know me, I'm a
yeah.
shameless beggar. I'll beg for anything. So, but anyway, thank you for being with us today, and thank your staff, and tell everybody at DSS we thank them for all their hard work.
Thank you.
Thank you.
Senator.